introduction, and thank you very much for the opportunity to contribute to this series. As Amy mentioned, I'm going to be talking today about the work that we do to engage with patients and end users in the governance around AI in healthcare. So my presentation is very much centred here in Aotearoa, New Zealand, but a lot of the themes, I think, resonate across other jurisdictions as well. So just my disclosures before we get started. I obviously do work for the University of Auckland here in Auckland, New Zealand, but I also work for our National Public Health Service. So we have one National Public Health Service here in Aotearoa called Te Whatu Ora, or Health New Zealand, and I lead research and implementation of AI within our health sector as well. And so what I'm talking about today is drawing on my experiences from both my research at the university as well as my experience in our public health system. And as Amy mentioned, I also sit on our National AI and Algorithm Expert Advisory Group, which is a governance group for the use of AI within our health sector. And so I'm going to talk a little bit about that in my presentation today. And I come from a background as a psychologist, a clinician working in our health system, and have brought that to digital health research and AI research more recently. And just to acknowledge that I have no perceived conflicts with the work that I'm presenting today. And I do just want to take the time to acknowledge also the funders of the research that I will be talking about today, my incredible colleagues, but also the participants and the patients that have contributed to the discussion and the dialogue around how we use AI in an appropriate and ethical way in healthcare here in New Zealand. Now, we all know about the opportunities of AI. I think there's lots of discussion about how AI is going to revolutionise our healthcare system. It's going to really mean amazing things for health around the world. But there's also a huge number of risks, and we're seeing more and more reports of these in terms of how potentially AI could cause some harm, or even just concerns, I suppose, that we need to be aware of and we need to take into consideration when we're considering whether we should be using AI in the context of health. These are just a random selection of snapshots of headlines of examples of where AI is contributing to bias and risk in patients and the healthcare system, and also just in terms of perpetuating existing issues or biases that exist in health and in our data, and the potential for AI to exacerbate those, not just create new potential biases and risks. And so it's these types of issues that are the reason why governance in AI is so important. And so we in our health system here in New Zealand, originally within one of our health districts here in Aotearoa, New Zealand, saw a need for leadership and governance over the use of AI in healthcare. So thinking about implementation of AI into health services, but also thinking about the use of patient data for the development and testing of AI. Now, we all know that AI is only as good as the data that it was developed and tested on, but getting access to that data can can be difficult because it is a secondary use of data often that patients haven't actually consented to. And so we need to make decisions about the use of that data and large cohorts of data on behalf of our patients. So that is where this governance model has come in. And so we published this paper if people are interested in more information about the governance model here in Aotearoa. Bear in mind that that paper was published before the onset of generative AI, which has changed the landscape considerably, but it gives you a bit of the background to this governance group that was established here in New Zealand. Now, the group, which is called the National AI and Algorithm Expert Advisory Group, brings together a multidisciplinary group of experts, both internal to health, but actually external as well, and brings them all round the table to discuss AI proposals. So proposals, as I said before, for tools, like a company might want to be implementing a tool, or a clinician might want to bring in a tool into the health service to be used in clinical practice. And so that type of example or proposal might come to us, but also from researchers and groups wanting to access data from patients, so real world data, which we want to encourage coverage, because then we know that AI will be developed on the right data. But they'll come to us asking permission to access that data for the purpose of AI. So this group has, as I said before, a range of expertise, and you'll see there that diagram there that highlights the 8 different areas of expertise around that table. And we also have access to a broader reference group of experts as well, where specific proposals might be quite niche. We will pull in other experts as well. And so this group meets and they go through all these proposals for the use of AI or development of AI and provide recommendations or endorsement for the use of or the progression of that proposal. The specific functions of the group is to provide advice, particularly to researchers who are wanting to develop or test AI tools. And so we provide them with expertise and advice quite early on in their process. But we also provide endorsement for the use of AI in clinical practice, as well as back office functions. So not just patient care, but also in places in the organisation where AI might be implemented to improve, say, efficiencies or productivity. And then we also provide advice and support to our staff. So our health organisation, Te Whatu Ora, has nearly 100,000 staff. And so we're providing advice and training as well on safe use of AI within their roles in the organisation. And we work across the sector. We work with our ministries, our different groups like ethics and funders as well, and our universities to work together to advance the space. Now, in order to enable the governance processes, we've developed a checklist, which is kind of a whole lot of questions that we pose to people to consider with the proposals that they bring to us. And I'm just going to go through that checklist and some of the questions that we ask. Again, if you're interested in this checklist, you're welcome to get in touch and we can supply that. It is an open and available checklist. And I'm just going to go through some of the key considerations around that checklist. But the idea is that we are posing these questions and ensuring that people are considering these things when they're considering the use of AI. The first question we always ask people, and it's a really, really important question, and this is broader than just thinking about use of AI in health. It's really relevant if you're using it in other sectors as well, whether that be research, whether that be teaching, business, etc. But is the use of AI in that context appropriate in the first place? People can get quite excited about AI and it's really cool, but often the use of AI may not actually be appropriate in that particular context. So we want to ask that question first and foremost. And alongside that, we want to know that AI is actually going to improve things. It's not actually going to make our jobs harder or more difficult or actually make things worse in terms of outcomes. We're also going to ask around whether the AI tool has been validated for the context that it's been used in, because we often see people trying to use AI tools that were developed in one context and using it in a completely different context, and that wouldn't be appropriate. So really just ensuring that the tool that they're using is appropriate for the context that they're wanting to deploy it in. And then the last one, obviously there, that's really important and is going to be unique to every individual setting, but we need to make sure that obviously the use of AI is going to comply with regulations in that setting. And so that might be organisational regulations or it might be governmental regulations, etc. Now, because we're talking about a health context, the next kind of domain or area that we want to ask people questions around is around the clinical perspective. So thinking about our healthcare professionals, our clinicians, and how they might be using these tools, and understanding whether the AI tool is going to impact on their judgment as a clinician. Now, that's not a bad thing. We know that AI has a incredible potential to aid in diagnosis, for example. And so that's okay, but we want the proposal, the researcher, to really understand the implications of that if it is going to impact on clinical judgment, and whether that is positive and negative, and any mitigations that might be needed to ensure that the harm is prevented. And then, are we potentially at risk of an over-reliance on AI undermining clinical expertise? And I'm going to talk a little bit in a moment about our patients, really having that trust in our healthcare professionals. They trust the clinician delivering that information and treating them more so than they trust in AI. So we've just got to make sure that we don't undermine that trust either when we're using them in a clinical setting. Obviously, we want to consider data when we're thinking about the use of AI. And so we want to know what data was used in terms of developing and testing the AI. Was that an appropriate data set? And was that data accessed through appropriate channels? So there's no copyright infringements, or, was it an appropriate secondary use of data, particularly where there's no consent obtained? We do want to know whether the tool is going to continue to learn from the AI, from the use of the AI. So when people input data into that tool, is it learning from that? And what are the implications of that? So is it storing that data? Where is it storing that data, and how? And who might have access to it? Have the patients, if patient's data is being used in the tool, have they actually consented to that? And are there any concerns around data privacy, confidentiality, obviously security and cybersecurity, but also the potential for re-identification? So what we know is that AI is incredibly powerful, not just in helping in terms of delivering care, but we also know that AI can be used to re-identify people. So deep learning techniques can be used, and there's some examples in the literature of where de-identified data has been re-identified. And so we want to really understand that, because there's a potential risk of harm associated with re-identification if the data has been de-identified. Obviously, technical perspectives are really important here, and the technical side of AI isn't my expertise, but we really do want to know how the AI has been evaluated technically, and how the proposer, the person who is wanting to use the AI or develop the AI, will assess for accuracy, and will this be monitored ongoing, particularly when it comes to generative AI, because generative AI is constantly learning and changing, and so will that accuracy be constantly evaluated, and how will that be done? Now, the ethical perspectives are really, really important. And this, again, is there's some overarching international principles around the ethical use of AI, but there's also going to be jurisdiction specific regulations and requirements. And so whether that be ethical or ethics committees for research, etc., but also clinical ethics committees in terms of clinical care or use of AI in clinical care. So we want to know that AI is going to comply with any ethical standards within that jurisdiction or within that context of use. And if it is research, that the correct approvals have been obtained from an IRB for the development or testing of that AI. And then again, are appropriate informed consent processes being followed? The next lens that we look at is equity and fairness perspectives. And so really looking at that potential for bias and how we will be able to evaluate for bias across ethnic groups and other groups. So not just thinking about ethnicity, but also thinking about other populations who might experience poorer outcomes, and particularly that the use of AI could perpetuate or exacerbate. And so really looking to evaluate bias and make sure that people are doing that correctly. We want to know that the AI tool can be used fairly and really wanting to ensure that the AI won't contribute to new or existing bias. The next really important lens that we put on things is around Indigenous people's perspective. So here in Aotearoa, New Zealand, our Indigenous population are Māori peoples. And so it's really important that we consider them in these governance decisions around the use of AI in health. And so again, this will look slightly different all around the world, but it's really important to consider these key priority populations in these decisions. And so, really asking the question around whether the AI was developed in a culturally safe manner. And so there's been a lot of work here around AI for Māori and the development of AI, ensuring that it is culturally appropriate for that population. We would look here in Aotearoa as well at Māori governance, so looking at whether they've been involved in any of the process for development or testing of AI, and whether they would support the use of AI in their populations. And we would look to make sure that it protects not only them as in terms of their health outcomes, but also in terms of their knowledge and their language. So ensuring that we protect what is considered a taonga, a precious part of that culture. And so, an important part of that is thinking about data sovereignty and Indigenous data sovereignty. So ensuring that we are upholding Indigenous data sovereignty principles in any use of data in AI. Now, legal perspectives is another aspect that we have to consider when it comes to AI, and this is incredibly complex because of often the involvement of industry and commercial companies in these tools, but also that often these tools are being used across international contexts, not just local contexts. So we need to think about legal requirements both locally and within the immediate area, but also thinking about international requirements in this perspective in this area as well. So not just our local, say our Privacy Act, which is a law that we have here in our country around protecting the privacy of people and particularly people when they're engaging with health services, but also thinking about some of those international laws as well. And then the last aspect on that diagram I showed you in terms of the perspectives that we look at is the patient perspective, the end user perspective. So we believe that you need to prioritise that end user in these decisions as well. So would our patients or would the public support the use of AI for this purpose? Is this going to be patient-centred care? And are we making decisions that are in the best interest of our patients and our communities? So we need to, when we're considering that, think about what are the risks to our patients from the use of AI, and are our patients aware of the implications of the use of AI in their care, but also the implications of data or their data being used in AI. And this is really important when it comes to particularly generative AI, where that data is being reused potentially over and over again, and really do our end users, our patients, understand the implications of that ongoing use of their data, and particularly where that data might be being stored in a cloud server in another country, another jurisdiction with different laws, or by a commercial company that might have different priorities as well. So, how do we ensure that our patients are going to be aware of that and okay with that? Oh, sorry, wrong way. So as I said, that consumer perspective is one of these 8 perspectives that we consider in this governance model around the use of AI in health services here in New Zealand. So it's one of those 8 perspectives. And so, to be able to consider the consumer perspective in our decision making, we've been undertaking engagement with our populations for the last 5 or so years, and through research studies and more broadly, to understand their perspective on the use of their personal health information for the development of AI and algorithms, but also the use of AI in their care. And these are just a few of the examples of the papers, that have been published from these studies, but we've got others as well, where we're trying to engage with different communities to ask their perspectives. Now, as I said, there's a number of studies that we've conducted, and a lot of them have been in-depth interview type studies as well as more broad, large surveys. But these are the 4 overarching themes that have come out of that work. The first is that people want to contribute to the greater good. This idea that they want to help others. So the use of their health information for AI should be for the greater good. It should be to help other people. So there's that real sense of contributing, which is really important here. The next is that they see it as really important that their data is being used. So, that people see the value that their data is used to improve the healthcare system and to contribute to science and advancing science as well. People are very aware that the data of patients in the past has been used to develop the treatments and the care that they receive today. And so they want to contribute to the treatments of the future and the care that is given in the future as well. And so this is very much about the use of their data. And so people were seeing this as a really important thing to happen. The next is that they want to be able to trust the health service to do this responsibly, to do this ethically. People want to be able to give that trust to us, to look after their data and use AI in an appropriate way. And so it's not just about respecting and protecting data, it's also about respecting and protecting them as well. And that last theme around respect is specific to this idea that we need to respect the patient's consent to use that data or non-consent, but also respect their data as being precious and as being valuable. So people are very aware of the value of health data and data more broadly in this world where these commercial companies need data to advance their products and their agenda. And patients are very aware of that. So they know that their data is valuable, and so they want that respected by the health service and anyone who is using it. So overall, patients were really comfortable with their data being used for the development of AI and the use of AI in their care because it was for the greater good. But this comfort came with a number of key considerations or conditions. So the first was that the information was stored securely and that it was protected. So they needed to trust us to have the adequate cybersecurity kind of processes and infrastructure in place to protect their information and them. Next, that any data use is de-identified. So data needed to be de-identified adequately so that they would not be identifiable in any data that is shared or used. They also want assurances that there could be no harms resulting from the use of AI or harms resulting from the use of their data in the development of that AI. They wanted assurances that there was good governance and oversight, and that included clinical governance. So they didn't want, say, hospital management or business leaders making the decisions in terms of governance. They wanted clinicians like doctors and nurses also involved in that decision making, and they saw that as really vital. One of the things around health information that was a clear consideration, condition on comfort was that their health information remained within the health system. So people have a real fear about their data being shared or sent externally and then on-shared. So continuing to be shared in lots of different places with them not having any control over that. So they're kind of bit of a fear about the kind of cloud environment, and so wanting it to be protected within the health system, and so enabling ways of people using that data without it being sent externally. And lastly, our patients want clear transparency and communication around the use of their information for the development of AI and the use of AI in their care. Now, I'm just going to talk a little bit more specifically about our more recent study, which was one-off scenario-based interviews conducted across our country in the last year or so. And we specifically wanted to look at different use cases around AI. And so we looked at three kind of key groups, one being people who are what we consider high users of the healthcare system. So those with like chronic conditions. And we also particularly were interested in those with mental health conditions and rare conditions, because the literature indicates that those groups may have differing perspectives around the use of AI in their care. We were also interested in those that might be what we consider low users of the healthcare system, so actually well at the time of engaging with the healthcare system. And so we engage with people undergoing routine screening programs. So, for example, mammograms for breast screening and the smears for cervical screening were two examples, but also bowel cancer screening and lung cancer screening, etc. And so those people that may not actually have an illness at the time they're engaging with the health service, but are still engaging with it for their care. And then the last group of end users we wanted to explore were our healthcare professionals, because our healthcare professionals are the end users that are actually engaging with the tools in practice, and they're the ones that are consenting our patients for the use of these tools. So what we were interested in is bringing together some of these different perspectives to our governance group and the decisions being made around the implementation of AI tools in practice. Now, these were interviews that we conducted, and they were scenario-based interviews. So we presented a scenario that was tailored to their particular situation, and we got feedback on that scenario in terms of what they thought about it, what they liked, what they didn't like, and what their concerns were. So I'm going to start off with the healthcare professionals. So those that are kind of they're at the front of dealing with patients and delivering healthcare within our services. So Similar to patients and the general public, our healthcare professionals saw huge potential for AI. They saw huge potential for it improving their or reducing their burden that they have in terms of burnout, but also just changing the way they work to take a time away from administrative tasks and instead focus their energies and time on supporting the delivery of healthcare and engaging with their patients. And so they saw this as a positive step in terms of improving the health system. They were really keen to see greater transparency, and they felt it was their ethical duty to be getting consent from patients and being transparent with patients about the use of data, but also the use of AI in clinical care. And so they really wanted to see greater ways of or increased transparency from an organisational level as well as at an individual level. Because they saw huge potential that if they didn't do this right, if we weren't transparent and we weren't communicating with our patients, then there was huge potential that this could harm the trust that people have in the health system and that trust that they have in their individual clinicians to provide their care. They had lots of concerns for data quality. So when data that they had collected was being used for the development of AI, they were worried about inaccuracies or missing context in that data and inconsistencies in how data is coded within the health as well. And so they were really keen to see very good data governance processes and ensuring that there were good checks and balances, I suppose, around the data that was being used. And so they saw data governance as being essential and that clinicians needed to be involved in that data governance. They were very clear that AI was a tool that could be used in their toolbox to provide care, but not as a replacement for a healthcare professional. They wanted to remain involved in the decision-making and patient care and not removed from the equation. So they wanted patients to still be able to talk to them, even if AI might be involved in diagnosis or treatment or their care. They did have a lot of concerns for the liability for when AI gets it wrong. And this is a really big issue, particularly when these tools are developed by companies that might be overseas. And if that tool gets it wrong, who's responsible for that? And so they wanted that kind of information to be really clear to them before they would feel comfortable using these tools. And there was a worry for confirmation bias. They worried that it would be too easy just to agree with the AI and not potentially challenge the AI. And so a real worry that it might remove their clinical judgment and they might then get things wrong if the AI was wrong. So that was our healthcare professionals. I'm just going to jump to our patients. So I'm referring to our patients who were more regular users of our healthcare system. So we had people with chronic conditions such as diabetes. We also had people who had mental health diagnoses and were receiving our specialist level care for mental health services in New Zealand. And we also had people who had been diagnosed with a rare condition requiring specialist care in this cohort. For them, they saw that there were key kind of mutual benefits in terms of the use of AI. They saw it as reducing the burden on an under-resourced system. So they saw the stress that our healthcare system is under, and particularly the time constraints that a lot of healthcare professionals have. And they saw it as potentially helping address that. But they also saw it as about improving treatment decision-making. They saw it as potentially providing a double check, if we think about treatment recommendations, but also for our people with rare conditions, they saw it as an opportunity where data might be informing decisions that is beyond just the clinical team that may only have been seeing 1 or 2 patients with their condition, whereas an AI tool might draw on data from all around the world with more people with that condition. They did see this as an opportunity to give back, and that's what I talked about before, is this idea that they do want to contribute to things improving, and so they see their data contributing to these tools as being a way of giving back. But they really wanted to make sure that any benefits from the use of AI were equitable, that people were going to equally benefit from the use of AI. They didn't want to see AI advance private healthcare systems and leave people who couldn't afford those systems behind. And so really wanting to ensure equity was at the forefront in terms of decision making. Next, in terms of governance and external involvement, our patients really just expected there to be really good governance processes and clinical oversight over the decisions being made. So they wanted to trust in that governance, and they wanted assurances that that process would be thorough and it would have clinical input within that process. When it came to their views about external involvement, people became less comfortable. There was a lot of concern about the focus being on commercial gain with, say, an external company versus where maybe the public health service might develop something and the intention be for public good. But they saw that the need for partnerships, for involvement of external parties. They just wanted to make sure that that was very carefully considered. And that it would be mutually beneficial, that these companies wouldn't just benefit off of patient data and then go off and make huge amounts of money from developing a tool. They wanted to see that patients would get that return of benefit. So that tool might be available to patients within the health system in the future, not just be there for profit. Our patients were also concerned that patients are so varied in their needs and in their context. And so there shouldn't be a one size fits all. And there's a little bit of a worry that AI might be seen as something that could be deployed more broadly. And they really wanted to see consideration to individual contexts and consideration to those patients who may not fit like the norm kind of the average. And so, we saw some really clear differences between those that were in those different groups that I mentioned, the chronic conditions, the rare conditions, mental health, in terms of what they saw the benefits of AI being and in terms of what they saw the risks being as well. We needed to consider the individual context and decision making. And then lastly, I do want to touch on the screening group as well. Now, this is a really unique group and where we have potentially very large data sets. And this will be the case internationally as well, where huge numbers of people go through routine screening on a regular basis. And so there's huge data that has incredible power in terms of what we could do for the development of AI. But equally, there's huge potential benefit in terms of implementation of AI, because we know that there's huge benefit. There's a lot of evidence to screening programs. And often we're seeing health systems put restrictions on screening just because of capacity and cost. And so often screening will be limited to kind of priority groups. And where that is resource constrained, AI has the potential to address that. It also has the potential to address wait lists. And I know here in New Zealand with particular types of screening, like diabetic retinal screening, as for example, there can be considerable wait lists into accessing that. And so, AI has the potential to fast track some of that process. So for example, in diabetic retinal screening, it can be implemented into the cameras and to immediately tell the user whether the image quality is good enough. So it doesn't mean that it has to go to a clinician to be assessed. And then if it's not good enough, the patient recalled at a later date, which can mean people don't come back for screening and get lost to follow up, or it's just a time and resource intensive process. It can also be integrated into the grading or the interpretation of the images as well. So the AI can be used to provide a result of whether a patient is low risk or high risk, or actually even in some cases diagnose a condition as well. And it can do that immediately, whereas some of our traditional services require that image to be sent to, in diabetic retinal screening processes, it would be to an ophthalmologist who would then grade that image and then send that result back and to the person who did the screening or the service that was responsible for that screening. And that can be quite a time-intensive and resource-intensive process. So there's huge potential in screening, and that's why it was really important that we considered this population within this particular, engagement with our end users. So when it came to talking to people who underwent screening, just to sort of acknowledge, that the bias in this sample was they were majority female who undertook in our screening cohort. In the other 2 cohorts, we had even distribution of genders, and this is reflective of the publicly funded screening programs here in New Zealand, where breast and cervical cancer screening are 2 of our biggest screening programs, and hence why we had majority of women taking part in this particular cohort. Our screening participants saw huge benefits to increasing access and accuracy of screening, and I think we got lots of comments, and I think this quote here illustrates it as well, is that actually rather than one healthcare professional staring at the computer to look at an image, potentially, AI could do that down to the pixel level. And so in terms of picking up, say, cancer or abnormalities, there's huge potential for accuracy with AI. And they saw the effect, the impacts of that in terms of improving the broader screening programs, so potentially providing more equitable access to screening. But they really wanted to stress, and this came through really consistently, and even more so than in our patient cohort, that they wanted health professionals involved. So AI should be a support tool to enhance screening, and humans still need to be involved in the process. So they didn't want to see AI deployed in screening programs and removing the clinician from that. So they were very aware that the AI wouldn't always get it right, and there was a need for humans to be interpreting the results as well. But also that the delivery of abnormal results to a patient and the implications of that require sensitivities that humans are trained to consider, whereas a computer is not so much. Transparency was a big issue as well. There was this kind of assumption that just because the data was less sensitive, because it was potentially just an image and it could easily be de-identified, that some people might consider it to be, less sensitive, less problems with using it. But actually, this cohort really stressed that they still wanted to know what was going on with their images. They wanted to know if the images were being used for AI development, but they were also wanting to know when AI might be involved in the delivery of the screening that they were undergoing. And they said that really consent should be obtained. And this was something that is a little bit more challenging when we're looking at historic data sets. So data sets that are maybe retrospective, where maybe they were collected, that data was collected before we even considered AI as a potential option. If we think back, 10 years, we weren't really thinking about the use of data for AI development in the same way that we do now. So our consent forms that we were using at that time weren't really set up to consent for this type of use. But the patients really stressed in this context that actually you can be prospectively consenting people now and keeping those consent forms up to date. And so where possible, you should be consenting individual patients for both the use of their data and for the use of AI in screening. And what the real worry was is if there wasn't transparency and consent wasn't obtained, that actually if patients found out about the AI being used or their data being used for other purposes, it could actually take away from them engaging in essential care. So it could undermine trust in the healthcare system and distract from them actually getting the care that they need, particularly where there's abnormal results. So there's potentially quite considerable harm that could come from that lack of transparency. And importantly, and sort of lastly, consistent with the other groups, there was a really clear need for good governance and the need for careful consideration of external parties' involvement in the development and testing of AI. This group really clearly saw the benefits of external partnerships. So, the healthcare system partnering with commercial companies, with universities and other groups across both the New Zealand context, but also internationally. And so they saw huge benefit in that, but they just wanted to ensure that there was careful consideration and governance over that, and that the benefit wasn't just for commercial gain, that there was mutual benefits and return of benefits to the health system. So there's kind of these 5 kind of thematic overlaps or themes that overlap in that work and are aligned with those previous studies that we've done as well. And so that really clear theme of the greater good. So end users want to be able to see, well, they know that there's potential benefits from the use of AI and the use of their data, and they want to make a positive difference. They want to contribute to advancing healthcare services. And so as long as the intentions are good, our end users are relatively comfortable with this. There's a really clear theme around transparency and trust. So they want us to be as transparent as possible about what is happening. And we need to do a lot of work around how we do that when we've got populations that have very different AI literacy. So it can be quite challenging in terms of being transparent and getting consent in this area where people might not have a level of literacy that is required to really understand what that data use and reuse might look like in the context of AI. And that's where governance is so important here. So if they can trust the governance model to get that right, then that's going to help with that level of comfort or maintain that comfort. In terms of external party involvement, patient health data, it really should remain within New Zealand. And this is really important for Indigenous data sovereignty. We need to protect the data of our Indigenous populations and ensure that that is used and respected properly. And so, there's a really clear need for us to have good governance and careful consideration over the involvement of external parties and ensure that the benefit to use of data for AI is not just to commercial companies or external parties, but also, or maybe primarily, the benefit should be to the people who have contributed that data or future generations of the population. They really need to know that any external involvement, and this is particularly relevant where there's external international parties involved, that they are going to be upheld to the same level of privacy and data protection that we would expect of parties in New Zealand. So, thinking about local laws, just not just international laws. In terms of the delivery of care using AI, it really was seen as a tool and not a replacement for the crucial role that health professionals play in healthcare, and that we need to consider every individual use case and context when making decisions about the use of AI, because not all patients are the same, not all health services are the same, and not all contexts are the same. And so that leads to that last theme, that the context is really, really important. And so, understanding individual context is a really important step in making decisions around the appropriateness of AI. But also when we think about generalizability or broadening translation of AI, we need to actually consider every use case individually. We can't just say, oh, it works in this use case, so we should roll it out more broadly. We need to consider those individual settings. And I'm not just thinking about different population groups in terms of patient groups. I'm thinking more broadly about geographical settings, age groups and other demographic variables, etc. So there's lots of different factors that impact on the context that we need to take into consideration. So what did all of this mean in terms of our engagement with patients and end users? Basically, they have very aligned views. There's very clear themes coming out of this work, but they actually have some really clear differences as well. And that, we need to be thinking about those differences, not just thinking about an overarching kind of approach. And so that one-size-fits-all approach is not really going to work to social license and also cultural license in terms of the use of AI within the healthcare setting. What we've also seen through this work over the last 5 or so years is that our end user views have changed and developed over that time. When we first did our first study back in 2020, obviously generative AI wasn't something, ChatGPT wasn't something that every second person was using regularly. AI wasn't as common. And so people had very little understanding of the implications of AI in their care or their data used for development of AI. Now, when you mention AI to someone, they will have very different kind of views on that, particularly if there's someone that is using it already, because these tools are everywhere now. They're integrated into Google, into basic everyday everyday kind of applications. But also the media has covered this a lot more. The hype. The media covers the hype and the potential of AI in terms of improving things and the excitement around that, but it also highlights all the harms and the risks. And there's been massive data breaches internationally that have also been in the media that influence our patients' perspectives on this type of thing. And then we're also considering the environmental impact of AI, which is something that is much more at the forefront of people's considerations now. And it wasn't so much previously because it wasn't as well known. But with the natural disasters that are occurring around the world and the contribution that tools like AI are having towards those, towards global warming and the environmental impact of global warming, people actually do take that into consideration when considering how comfortable they feel about AI. And so there's a real need that when we engage with end users, we do that regularly. We don't just take a snapshot at one time point and feel like we've ticked that box. We need to go back and re-engage with these end users on a regular basis because those views will differ over time. And we expect those views to continue to differ as AI is integrated more and more into health service delivery. So I'm going to leave it there, but I am happy to take questions. And just once again, I want to acknowledge the contributors to all of this work and also the opportunity to present to you today. Thank you.
Thank you so much, Rosie, for that very insightful. Lots to digest. You'd think it's when people have these ideas, right? But actually, when it comes to the implementation, that's always going to be the hardest. So I think you've really highlighted some really pertinent points. And we'll just go to the chat in the audience to see, are there any questions from the audience? Reminder, you can either put your question in the chat or you can raise your hand using the function on Zoom. While we're waiting for some questions, I did have a couple, Rosie, just to ask. So I was thinking about where you said context is one of the main important things, but actually you highlighted that actually it's not that simple because it's not just thinking about a setting. So you couldn't really apply like, oh, if I've got the context right for primary care, this is okay. Because actually, as you said, well, what about is this primary care and the catchment, the population it's serving? Is it an older population? Is it a different ethnic makeup? So for our audience, and also thinking, I guess, if we're trying to implement something for our end users, how would you suggest thinking about adapting something for different contexts? And I know some of our audience may be like managers of multiple practices. So it's like, it might not be practical go into each one, but is there some way do you suggest to start? Like, do you start off with something like this is generally works for both and then you go and adapt it with each practice? Or do you have any learnings from your experience?
Yeah, I think that's a really important point because we can't develop an AI tool necessarily for every single individual context, and it's just not going to be appropriate. And I think we can learn from lots of other areas here, not just tech kind of areas. But the important thing is understanding the context in the first place. So understanding what maybe are the differences in this context from previous contexts, and that comes back to those questions that I put up right at the start about the appropriate use of AI. So first of all, what is the context we're wanting to use the tool in, and is it an appropriate use of that tool in that context? And understanding, so if we know about the tool, if we know enough information about the tool, we'll know what context it was developed and tested in. And so we'll be able to see whether, how aligned those contexts are. What we can also do is just thinking about our monitoring and evaluation around implementation. So often it might be that we just need to have a closer eye when we start to implement across different settings. It's really important that we continue to monitor AI. We don't just think, one-off evaluations are enough, particularly because they're changing and learning all the time. And so thinking about a monitoring and evaluation plan that allows for consideration of context. I think there's lots of kind of different ways that we can do this, but it's not necessarily a need to start from scratch in every different context, and that's not going to be economical either. But really just understanding the context is the first step.
It's helpful as well to know your point. As you said, AI is constantly learning, so it's important as well to think about the ongoing evaluation, because even if you spent a lot of time getting it right for each practice, as you said, healthcare needs, populations age, people might move. So again, the needs change and then AI needs to learn differently.
Yeah, and it's a really good point, that idea that actually once we deploy an AI in a setting, if it is learning from that setting, so if it's being continually trained on the data that's being inputted into it, it's going to change and become more acclimatized to that setting.
Mm.
Now, that's a really good thing potentially, but if there's some biases in that particular setting, that's something that needs to be considered. It might be that setting isn't, representative of a wider population. So actually the tool becomes less safe maybe to be used, or the proportion of patients from different groups is different in that setting, or it's being deployed in a slightly unique way. That's going to have a really big impact on the safety of that use of that tool ongoing. And so that really important consideration of ongoing implications of the use of AI, and really considering the implications of the data that's being inputted into it and how that data is being used.
Especially as we know, it can only learn from how good the quality the data is. So especially if poor quality data is going in, then we should be flagging that.
Exactly. Yeah,
Um,
exactly. And that's where it's really important in terms of the biases that exist in our current data set. So really understanding the data sets in the first place. And in a lot of contexts, people aren't really, I suppose, data literate in terms of really understanding the quality of the data set to start with. And so that's a huge part of the question as well that we need to explore.
And on that note of data, there's a question from a participant on the audience. They're suggesting that concerns about data going to third parties or commercial organizations could be reduced if the AI model was actually held locally, for example, just on a local PC or mobile phone rather than a cloud-based model. But obviously the size of the model would be smaller, and this could impact on the ability of AI to learn. They would ask your thoughts around the benefit and risks of that proposal.
Yeah, thank you for that question. It's a really good question, and this is something that we grapple with, and I think a lot of people do. I absolutely agree. The ideal is that we run things locally, and then we remove so many of the risks around things sitting in the cloud, cybersecurity breaches, but also if we think about data sovereignty principles and the importance of local storage and protection of data. The issue around that is that a lot of these tools require quite a lot of processing power and storage on local devices, etc. And actually having the infrastructure to do that is not always possible. And so actually using the cloud is ideal in that consideration, or that context where the infrastructure may not be present locally. Also, you're right around the size of the model as well. So there is research into in terms of the more data you have contributing to a model, potentially that's going to be more accurate. And so, that is actually really beneficial. What we can do then is once it's developed, make it local, and we can turn off that training element of it. And so it's not continuously learning. The downside of that is it's not learning, it's not getting better potentially. And so we're constantly weighing up that as well. So you're right, there's risks and benefits to both of those approaches. And it's going to be an individual context that makes that decision, or balances that and makes the call as to the best way to do it. We know that in not all contexts can we have that kind of infrastructure to do things locally, and we often need the ability to use international or external kind of platforms. But where it is possible to do it internally, that is often the best option.
Mm-hmm. No, fair answer. It's that fine balance again, trying to see and think about the objectives of what you're going to use AI for. We have another question from the audience. Can you assess the level of AI maturity within your organization, specifically in terms of literacy and ethics? And then at which maturity level do you expect all processes from top management to operations to become fully seamless?
Yeah, thank you for that question. That's an incredibly complex question that I think organisations all around the world are grappling with. And this isn't just unique to health. This is across the board. I think we've got a real issue in terms of AI literacy across the board, from our general public through to our hospital managers and our clinicians, etc. If we think about the clinicians who are working in the workforce right now, when they went through their training programs, they were not trained in the use of AI. They were not trained in how to use this safely, how to use this ethically. And so obviously that's changing as training programs come up to speed, but I think we've got a real issue there with a lack of AI literacy across the board, and we need it to be across the board because these tools don't just affect one person within an organisation. They're going to be affecting a lot of different people and different pathways within an organisation. And so I think we do need to do work more broadly around how we address that, and whether that is done at an organisation level or it is done as a system or a population level is something that is a really interesting debate and discussion. And, we can look at to digital literacy and health literacy more broadly and the learnings in that space in terms of how they've addressed that. In terms of ethics as well, I think we're seeing very varied maturity in ethics around AI as well. And this is thinking about our ethic review boards or ethics committees in terms of approving things like AI research, but also more broadly around the ethical use of AI. And so, and I often think about the kind of Gartner hype cycle. Many of you will be familiar with that as an example here. Often we have these early adopters that get really excited about this tech. They just jump on board with it and often don't sit and pause and think about the ethics of what they're doing. And then we often have these people that take their time and build that confidence and might be what we consider a slower adopter. And I think we're seeing that play out in the AI space. In terms of the second part of that question, which maturity level do you expect all processes from top management to operations to become fully seamless? I don't know. I think that's a really interesting question. I can't foresee that happening right now in our organisation. I think we've got a long way to go. I think AI right now is a lot more hype than it is actually practical, or suppose that we're actually being used or implemented. I think we're not there yet with it really being widespread kind of implementation across our health system here in New Zealand, and that's going to look really different in other contexts. I wish I could answer that, but yeah, I don't know. I think it's going to be an iterative process. And the problem with the AI landscape is that AI landscape is changing every single day. It's kind of something we can't really predict. And so although we might get to a level of maturity, I feel like the ground is shifting all the time. So that maturity is constantly shifting as well. So sorry, I haven't really answered that question, but it's a really important one that organisations are grappling with.
Okay, so the whole thing is I guess, is a learning process as everything's changed.
Yeah.
I think we have time for one more question. There's one more from the audience around synthetic data. This is synthetic data is being used in other fields which can help improve AI accuracy. Do you think this is applicable for healthcare?
Absolutely. Yeah, we're seeing synthetic data being used in health AI as well. And I think there is huge potential around that. Again, those same considerations apply, whether it's synthetic data or it's real data in terms of, biases and the origins of that data to start with. Often synthetic data is coming from real data. So, there's still going to be some implications of that. But yeah, I think that's a really great question and point for the audience to consider, is that synthetic data has huge potential, particularly in that early development phase, potentially when we are just kind of developing tools or testing tools before we're actually looking at real world kind of scaling and implementation. So we do need to test these tools on real world data as well, and real world local data. So thinking about international tools, but synthetic data can be incredibly powerful at those initial stages.
Great. Thank you so much, Rosie, for your time. And thank you everyone who's come online. And I know anyone who's watching the recording later on as well. Thank you for all your attendance. We've learned so much and I really appreciate your expertise, Rosie.
Thank you.